Thank you. So during this project, it became apparent to us that Tennessee's rural hospitals could be stabilized, averting future closures through a series of policy changes. And as a result of our listening sessions in the communities, we have formulated the following policy recommendations. And these are derived from policy-oriented themes, which emerged from the listening sessions and from key informant interviews with rural hospital CEOs, as well as consultations with statewide organizations which have an interest in rural healthcare delivery, and debriefing discussions among our committee members. Next slide, please. Next slide, please.
Well, I think she thinks we're taking a break. I think she thinks we're on a 5-minute break.
Oh, okay.
Yeah. Yeah.
Oh, here we go.
Oh, maybe not.
We'll keep going. Okay, so our goal for these recommendations is first and foremost to heighten awareness of the need for transparency and engagement between rural hospital operators, local governments, and agencies through outreach, coordination of resources, and improved communications. And then we had some additional goals, and these included reducing the gap between our current market healthcare model and any given community's health needs, and also to develop new and innovative models of care to expand the reach of medical services, including the delivery of emergency, diagnostic, specialty, and rehabilitative care. And also we wanted to develop and expand innovative funding streams for rural hospital operations. Next slide, please. So we recommend that policymakers approach the rural hospital crisis comprehensively, incorporating federal, state, and local action, and building on lessons learned in providing care to the underserved through alternative funding streams and mechanisms that maximize community participation in service delivery. Next slide, please. And while these following recommendations set the stage for stronger and more sustainable rural hospitals, trust between hospitals and the communities they serve is at the core of any thriving hospital system. This trust grows through open dialogues regarding the needs of the community and the hospital's activities performed to meet those needs. And this is going to involve multilateral community engagement that brings together patients, healthcare providers, government, and business leaders to ensure that our rural hospitals not only survive, but prosper. Next slide, please. And while we do have recommendations at the federal level, our main emphasis today is going to be looking at state and local measures. So we'll go ahead and move through these next two slides. So next one, please. And one more, please. So as we move to our recommendations for Tennessee's policymakers, I would ask that you be thinking about some recommendations that you feel like the state needs to enact first as we move through, and ways of prioritizing what may be of the greatest benefit in the near term. So our first recommendation is that the state accept federal funds for Medicaid expansion, and there is evidence through several studies that rural hospitals in states that have expanded Medicaid are more stable and have a lower incidence of hospital closures. And one study that I read recently indicated that even prior to COVID-19, that in the non-expansion states, the operating margins in these rural hospitals was a minus 0.3%. And that was an average. So some of those hospitals were even worse off than that. And that was before the crisis. So as we move on and think about this further, you know, the other thing that Medicaid expansion will help do is open coverage to more individuals that will not just improve the hospital's financial performance, but also open the door for many other services that those Tennesseans need at multiple levels. And so we'll move on to some of our additional recommendations. And one is to consider extending the Rural Hospital Transformation Act grant funds before, or for longer rather than that expiration date of July 1st of next year. And just so, you know, for those of you that may not be completely familiar with that act, it served to provide strategic planning services for the grant awardees. And next, we would also recommend that we reform the Certificate of Need program to investigate hospital failures and failures of those operators to provide these services that they promised to provide. And also to reform that program to encourage the use of mini hospitals, stabilization sites, alternative critical care centers, and other creative responses to the loss of hospital services. And we would also recommend reforming insurance laws to allow rural communities located near state borders to form multi-state insurance cooperatives and/or networks, and also require insurers to streamline the network licensing process to prevent prolonged gaps in service. Oftentimes when a hospital operator transitions, many of those networking agreements have to be renegotiated, which oftentimes will not only delay reimbursement, but still leave those residents that have the cards, as Randall was saying, or Claire was saying earlier, you know, they may have their coverage, but may not be a network. So that's something that needs to be streamlined and put into a more rapid processing. We'd also ask that insurers include rural hospitals as in-network providers for appropriate services, and that the hospitals be required to notify surrounding communities in advance of significant changes in service. Next slide, please. And so we'd also encourage the Tennessee Health Services and Development Agency to assist local communities in identifying minimal levels of service that are needed in each community and generate ideas for meeting those needs. And also we'd ask that the Transportation Department consider improving roadways that link rural communities to hospitals, and expand affordable broadband coverage throughout rural Tennessee. And that's something that there has been headway in creating additional areas of service. But even now more than ever, as providers are moving toward telehealth services, we see that this is very important. We'd also recommend funding for model rural healthcare facilities and offer grant opportunities for innovative care delivery in Tennessee's economically distressed counties, which have been particularly vulnerable to the effects of this crisis. We'd recommend that there be incentives for opening and operating opioid treatment centers in rural hospitals and communities. And that's something that all of us understand has really hit these small towns particularly hard, is the opioid crisis. We'd also recommend periodic audits of Tennessee's joint annual reports. These are submitted by hospitals and available for public review, but oftentimes there can be errors in those reports, and so they don't really lend valuable data if they've not been audited and corrected when need be. We'd also ask that hospitals be required to collaborate with local EMS and require all hospitals to provide annual reports to the communities they serve, detailing their financial status, the current service offerings, and metrics of how it's meeting the needs of the community. Next slide, please. And there are several things that would require joint action by the state and the federal government. One is global budgeting, and that's something that we've heard from hospital CEOs that would really allow for a more predictable revenue stream. And so that's something that's been shown beneficial in a couple of states that have piloted these programs, Maryland and Pennsylvania. So that might be something that Tennessee could work with CMS to pilot a program here. We'd also ask that disproportionate share payments continue after a hospital closes to fund alternative systems of care and provide direct operational funding for rural hospitals that are sole community providers. And we would ask that the state and federal governments also fund project access programs in rural communities, and these link uninsured patients with hospitals and providers. And we'd also ask that there be subsidies for costs associated with accreditation of rural hospitals. That's not an inexpensive process, and so we feel that that might also improve quality while assisting in some of their expenses. And the other thing is that we would ask that all hospital purchases be reviewed and that a maintenance effort be required by those operators. Next slide, please. And at the local and nonprofit sectors, we have the following recommendations. Educate members of communities regarding hospital reimbursement, financing, and decision-making. That's something that many in the community have said that they just didn't fully understand how all of this operates. And so if there were education sessions available, that might assist communities in understanding all of this a bit better. Also encourage community members to support their local hospital. And again, this circles back to that question about trust. And so if you have those routine dialogues and you can really boost that support at the community level, then that's going to also help sustain the hospital. We would ask that communities implement needs assessments every 3 years and that be done for all rural hospitals and not just those tax-exempt facilities that require that at this point. We think that furnishing training for all hospital board members on a routine basis would be beneficial. And, you know, in terms of reaching out to policymakers and legislators, it's really important that communities develop long-lasting relationships with those legislators and that you focus on problem solving to meet the needs of the community, not just at the hospital, but for all health needs. And we also feel like candidates should be challenged to generate and then follow through on proposals to address this problem. And lastly, communities should inform legislators and other stakeholders of those community needs on a regular basis. So again, having that open dialogue is very beneficial. Next slide, please. And we do have some resource materials that we have put together, and we can send those out to all of you after we finish the webinar. But these are meant to provide links to various resources that are available online. Some of them are articles, some of them are other websites that have even more links to additional resources. So we feel like these can be beneficial, and I believe these will be in our toolkit as well. Next slide, please. But just briefly, these are organized around organizations that are concerned about rural health, resources for rural hospitals, mobilizing the community, information about emergency care and quality of care, and also reimbursement and insurance coverage, telemedicine, and also links to legislative actions that are being considered. Next slide, please. And this is contact information for several of us, so please feel free to reach out even after the webinar is finished, and we'd be happy to hear from you. Next slide, please. And we really do appreciate your time today. I know Saturday morning is a precious time with family and time off from work oftentimes, so we do appreciate you taking time to spend dwelling and understanding more about this issue. So any questions we'll be addressing momentarily. Thank you so much.